I'm so excited today. Thanks everybody for joining us. I really appreciate everybody taking the time out of the day to join us for the talk today. I'm really looking forward to this, and I hope it's informative for you all as well. I know many people have asked for a training similar to this, and I'm so thankful to Dr. Rodrigues and Dr. Foster for being willing to join us and share this information. I think it's going to be great. Today's presentation is going to be given to us today by Dr. Foster and Dr. Rodrigues. Dr. Foster received her master's degree and doctorate degrees in educational and school psychology from the University of Georgia. Don't hold her against that. Don't hold that against all circumstances. She's a licensed psychologist and assistant professor of pediatrics at Vanderbilt University Medical Center and Vanderbilt TRIAD, the Treatment and Research Institute for Autism Spectrum Disorders. Dr. Foster provides diagnostic and therapeutic services at Vanderbilt Center for Child Development and Pediatric Primary Care Clinics. She's also a board-certified behavior analyst who coaches caregivers to support young children's social communication and engagement during everyday family routines. And she's also involved in medical education, quality improvement, and research, where she works to increase equitable access to care using innovative assessment and service models, including telehealth and community partnerships. Dr. Rodrigues received her master's degree in special education and her doctorate in school psychology, both from the University of Oregon. As a school and clinical psychologist at TRIAD, she works across TRIAD's school-based professional development team, training school psychologists in autism evaluation. She spends much of her time working with educators to help them better understand the signs, symptoms, and opportunities for support of individuals with disabilities and comorbid mental health concerns, and working directly with children and families with disabilities and/or mental health concerns. Dr. Rodrigues serves as an advisory board member on the Mental Health and IDD National Training Center and is currently the Tennessee Children's Mental Health Champion through the Association of University Centers on Disabilities and the CDC. I think we're very fortunate to have them today, and I'm looking forward to them talking to us about, so you have autism concerns about autism, challenges and considerations and resources when making a referral. Thank you so much for joining us.
All right, well, great to have everyone here. I'm going to go ahead and share my screen, hopefully successfully, and make sure I can see you all on the side here. Does everything look okay to everyone? Okay, perfect. So I will go ahead and get us going. So today at the end of our webinar, we're really hoping that you will be able to better understand a range of different core characteristics of autism and how they might look kind of across the full range of clients that you might be working with. We also want you to be able to identify some of the key challenges and factors to take into account when you are considering a possible referral for autism. And then we also want you to just feel better equipped in making those referrals when they are appropriate. So we're hoping to provide you with some resources that will allow you to connect your clients with different services that can benefit them, including supports that they're able to access while they're waiting for an autism evaluation, because we know that can be quite a lengthy process of kind of a lag time where they're waiting for some answers. And then we also want to help you know just about some existing resources that are already out there for different families and for providers that just might be helpful whenever there are concerns for autism that come up. So before we get into more of the referral tools and resources that I spoke about, we just wanted to focus everyone's attention first on some of the key characteristics of autism and what are the specific behaviors that might be prompting concern for a referral in the first place. So we wanted to start just getting some input from you all here. So you can scan the code if you're in a position to do so. You can also feel free to chat if that's easier for you and you're not able to access the Padlet right now. But we would love to just hear what kinds of behaviors or concerns might have prompted you to consider a referral in the past or prompted you to place one. And then also just to hear what are some of the key behaviors or things that you think of when thinking about autism and what might prompt a further evaluation. So we have some different areas of development listed here: communication, social interaction, play and interest, and then kind of an other column just in case there's things that don't fit into those other categories. But feel free to just put in anything that comes to mind of what might cause you to place a referral for autism evaluation. I'm going to kind of keep tabs on my phone here. So I see some coming in. So lack of shared experience socially, loss of language skills previously mastered, so some regression, withdrawal, perseveration on certain topics, being really focused in play or in your interests, perfect. Lack of imaginative play. And then, yeah, we oftentimes might think about the possibility of autism with some of the other behaviors that come up, right? So aggression, kind of having a degree of aggression that is prolonged or kind of goes beyond what we might expect at a child's developmental level, inability to be soothed or redirected, having repetitive qualities, so repetitive play. Perfect. These are great examples. Easily triggered. Yep. So difficulty coping with changes in routine. So yeah, a lot of behavioral challenges tend to be, I think, the first things that people notice and that cause challenges in children's lives, and that might prompt a referral, even if they aren't kind of the core features that we think of with autism. This is great. Thank you. So, just going along with all y'all's responses that you gave us too, we hit on a lot of these different things. We know that autism spectrum disorder is a developmental diagnosis, and it is behaviorally defined by one, showing differences in social communication in this blue circle, and then two, showing some restricted or repetitive behaviors in this green circle. And so y'all hit on kind of both of those big areas in the responses you gave, with some of those social differences and engagement, and then some of those repetitive kinds of behaviors or inflexible behaviors that you mentioned in those two columns. And then according to our diagnostic manual, the DSM-5, we expect to see key differences in 3 different areas of social communication on the one side, and then at least 2 different areas of repetitive and restricted behaviors on the other side, either currently or by history. We also typically expect these differences to be present in early development, and they have to cause some form of impairment in everyday life across multiple contexts. But we know in practice, right, things are not always so cut and dry of just seeing things neatly unfold in early childhood and these clear little categories that stick out really obviously in early development. And so we know we can identify autism in early childhood, but for a lot of folks, right, it's something that might not be on people's radar until later on in life. And then when you throw in challenges and challenging life circumstances that might be going on for different families at different periods of time, these concerns also might just not stick out really clearly or even be able to be investigated more early on. We also know the DSM-5 notes that characteristics of autism might not actually become fully manifest until later on in life if social demands and expectations start to exceed an individual's capacity. And we also know that individuals can mask these types of characteristics by some of the strategies that they've learned for coping or for compensating for challenges that they're having. So there are just a lot of different environmental and external factors that really influence how and when these concerns can come up. And then since we know it's very difficult to access autism evaluation and services too, this is another variable just that adds to that delay and that can kind of murky the picture for different people. And then we also know that there's a wide spectrum, just like the name of the diagnosis says. So you've probably heard this phrase before. If you've met one person with an autism spectrum disorder, you've met one person with an autism spectrum disorder. And this is because, there's a ton of variability along the spectrum in terms of those strengths that are noted and challenges that are noted. Part of this also relates to the fact that we know that spectrum diagnosis now encompasses what used to be several different diagnoses, like Asperger's syndrome, autistic disorder, and pervasive developmental delay. So it's kind of all here in this one bucket now, which creates a lot of variety. Although we know that this variability exists, I think that still most trainings and materials that you'll see out there, and even, pop culture representations, if you think about shows and movies that portray characters with autism, All of these things I think still really tend to emphasize particular and really specific profiles of autism. And I think this is something that can really come into play during the referral and the evaluation process, because different people like caregivers, teachers, providers, therapists, they may not all be on the same page about what autism looks like, especially in older kids and in more complex situations. And so I think this can sometimes cause a lot of confusion or just result in kids being misunderstood for lengths of time. So today, with this in mind, we really wanted to spend some good time up front just giving you a true variety of examples of characteristics of autism, since it's really important to be able to recognize these, because that's at the core of understanding what autism is and knowing what to look for when you're making a referral for an evaluation. So just focusing first on the core area of social communication, the first symptom, that we tend to see is differences in social emotional reciprocity. I think this can sometimes be a term that is a bit general or nebulous to people, but it really comes down to just the ability to engage with others and to share thoughts and feelings, or just simply kind of social give and take. And so with this idea of give and take, it can be useful to consider the give part or the social approach, the take part or the social response, and then the back and forth quality of interactions as well. So starting with just that social approach and moving along the spectrum, we might see kids who, really infrequently are making social overtures to others. And I think some of the responses on the Padlet hit on this, right, of kind of being more withdrawn or not engaging as much with others. This is the sort of classic example of ASD that I think a lot of people are familiar with, where we might see really limited social initiation, and caregivers might say things like, oh, he's happy doing his own thing or not really playing with others. But it's also really important to consider the consistency and the quality of overtures, and not just how frequently they're happening. So we might also see kids who do initiate, but only in specific contexts. So usually this is more often in times when they need help or need something, but not just purely to be social. We also might see kids who initiate a lot and socialize a lot, but tend to do so in a very one-sided manner that is focused around their interests. So this typically is going to involve a lot of talking and telling, but not really conversing in a social way back and forth. So I once had a family kind of describe their child as, being like a little announcer who loved to have an audience and loved to inform others of things, but wasn't really having a conversation with them. And then we also might see atypical or just unusual social approaches and overtures. So one thing that comes to mind is a child who has nice language skills and age-appropriate ways of communicating, but might make overtures like acting or making noises like an animal instead, even though they could engage with others in other ways. I also once had a client who would go up to other kids using a really particular bow and body position like Sonic, because that was his favorite passion. And so that was one that, was related to his interest, but obviously unusual for other people, even though he was really socially interested and socially engaging with others. We also might see kind of developmentally unexpected approaches. So, for example, some that seem really formal for the child's age. We also see kind of our greeters who seem overly friendly and somewhat indiscriminate in how they engage others. So these might be kids who introduce themselves to everyone in the waiting room, or kids who kind of run up and hug you the first time you meet them or when they don't know you very well. And then in terms of responses, we also see inconsistencies here. So at their clearest, social responses that are related to autism might involve a lack of responsiveness. So we might see these kind of classic ones. And I'm just realizing I might not have shared the sound. So let me just double check with y'all if you can hear this. Oops. Sorry.
Evan.
Can you hear? Okay.
Evan.
Perfect.
Evan. See, maybe if you can get him to respond to you now, you can use touch with his name, like give him a little tickle or something. Evan.
Perfect. So this is, again, kind of the more well-known picture of autism, I think, that most people have, where we see that limited response to name or to approaches from other people. But especially as kids get older, we also might see responses that are limited but look different. So this might be silences in conversations or just a lack of response to comments from others. They also might be just responses that seem a little bit uncomfortable or awkward, kind of like this, where there's an extended silence before a child just returns to their safe topic or their topic of interest without really acknowledging what the other person said in the conversation. And then there might also be responses that seem a little bit blunt or negative, even though the child might not be intending to come off that way at all. So I was working with a school-age client, and he was having trouble figuring out how to turn on a radio. And so I kind of said, oh, I can help you with that, just to remind him that I was available for help. And he said, well, it didn't work for me, so it's not going to work for you. So just kind of very matter of fact or straight to the point without kind of understanding how some of that might come off at times. And then last, we want to look at the social interchange and that back and forth. So in play, we might first see reduced imitation of others or reduced back and forth play. So I'll play this brief video of two young twins. So the play on the right is more indicative of what we see with autism.
Good boy. Ready, set, push. Go. Push. You can push.
Right. And then as we kind of move older and look at both younger and older kids, we might see just more independent or parallel play. So we might see children playing near others, but not really doing a lot of sharing of objects or enjoyment with others. And then we also might see more one-sided or directive play, where there's a lot of social interest and engagement, but there's just not that reciprocal quality to the interaction. We can also look at back and forth in conversation and spoken communication. So we know that language delays are no longer part of the core diagnostic criteria for autism, but even still, we see that many individuals with ASD may still struggle with fluidly expressing themselves. They might have trouble communicating about more complex or abstract situations, like if they're having a problem or about their emotions. We might see challenges with comprehending language, especially things that are not literal. And then we might just see challenges in using language in a social and a turn-taking way. So some individuals with ASD might have really nice vocabulary and age-appropriate speech and language skills, but still might struggle with actually using that language in a social and pragmatic way. So just wanted to pause for a second and just thinking about this first area of social emotional reciprocity. We wanted to give folks an opportunity to just share about any examples they might have come across in their own work with clients. So just related to this social approach and response and back and forth interaction, are there examples that have come up for you with clients recently, or that might have prompted a referral in the past? And you can feel free to chat, or you can also unmute and share. Whatever you're comfortable doing is fine. Lack of interest in playing with peers. Yeah, so just that limited interest in kind of approaching or in having that back and forth with others. That's great. Social anxiety versus autism. So I think that's a great question. That's something we're going to get into in a little bit, but I like the thought of, right, we might see limited engagement, but that doesn't always necessarily mean that's autism, right? There's many reasons that might be going on. So I think that's a great point. And then we have a couple other examples. Get elevated quickly when strangers talk. Yeah, so that response can vary to whoever's approaching them. They could be fine with really familiar caregivers and people that are safe, but with some others might respond in unexpected ways, seem self-centered. And I think that goes back to, again, kids might not intend to come off a certain way, but their lack of that reciprocity in some of the conversation and interaction might come off as really self-centered or really just focused on what they want to talk about. Getting very dysregulated when daily routines are changed or interrupted, overwhelmed by too much stimuli. Yeah. And so we're definitely going to get into more with some of these repetitive behaviors. But I do think that those things can play into with social interactions, right? Where you might see a lot of dysregulation or discomfort because some of these other things and sensory differences that we know exist can be bleeding into how they interact with other folks. So I think those are great points. Thank you guys for all of your participation. That's great. So then moving on to our next area of nonverbal communication. In younger kids, one thing that we often look at and focus on is joint attention, which is kind of depicted here in this picture. So this is just the idea of being able to share focus with someone else through visual attention to both that person and then another thing or object. So we typically look at a child's ability to shift their gaze between these 2 points. So in this example, we would be looking to see if the boy is able to look at the butterfly and at the woman and then back again, or vice versa. So kind of sharing that attention between the point of interest, but also with her socially. It can sometimes be difficult to get children with ASD to share attention in this way. So when the adult or the other person is the one trying to point things out to them or to try to direct their attention, we also might just see that they might not initiate these types of moments as much. So might not be checking in as much or trying to get your attention to shift to something else or to share their interests with you. And then limited eye contact, I think is probably one of the top things that people associate with autism. More often we'll see just more inconsistent eye contact or intermittent eye contact. That depends on the child's interest or motivation. So again, kind of going back to what we talked about with gravitating towards certain topics or interests, we might see that there's good eye contact in moments when engaging around those topics, or when children are the ones kind of seeking out an interaction or attention. They might kind of use all of their tools and use that eye contact really well to secure attention, but we might see it be inconsistent where when others are the ones seeking out the interaction with them, we're not seeing the eye contact be as strong. We might also see eye contact, but eye contact that has really unnatural quality or an inflexible quality to it. So it might be kind of intense staring or just looking at people in a very particular way that doesn't feel natural. We also see differences in gesture use. So just like with eye contact, this is not necessarily an all or nothing thing. We're not necessarily seeing a complete absence of any gestures, but in typical development, we really want to see a good range of spontaneous gestures that go along with communication. And we expect them to come up, pretty frequently in everyday communication. We also want to consider just the quality of the gestures. So if there's an unusual quality or really repetitive quality to that gesture and how often it's being used. And then similarly with facial expressions, we want to think about that range and that quality. So some kids with ASD might use kind of a limited range of facial expressions, like here, kind of have more of a neutral expression that they maintain. But we also have to consider how socially directed facial expressions are, whether they're being used as communication with another person. And again, with the quality, thinking about, are these natural facial expressions that go along with the situation, or do they maybe have kind of an exaggerated quality or an unnatural quality to them? And then lastly, we really want to think about how individuals are combining and integrating all of the nonverbal tools on the slide, and then using these along with words and tones of voice and body posture to communicate, as well as their understanding of all of these tools too. And young kids on the spectrum, when we think about their integrating of communication together, we might see kids who use gestures, but are not also coordinating that along with eye contact. So they might hand things over to a caregiver or reach for things, but not really coordinate that well with looking at the person. They might be more focused on the object. And then we also might see a lot of physical communication. So things like pushing and pulling caregivers to a certain place, kind of what we call hand as tool use. So taking a caregiver's hand and placing it on something that they need help with to kind of use it as a tool. All right. So thinking just about nonverbal communication, wanted to see, again, if y'all had any examples of these differences that you've come across with different children at different ages. And then I think, again, this is a great question just about some attachment difficulties in autism. So we're definitely going to try to give you guys some tools here in a minute about, how to differentiate some of that, because it is very complex, especially in the populations that I know that you're working with. All right. So then our last characteristic just in that social communication domain is differences in developing and maintaining and understanding relationships. And so in their most obvious form, and I think what people tend to think of immediately, we might see limited social interests in general. So reduced shared social play or imaginative play, just not really initiating a lot with others like we've talked about before. Let's see, here we go. And then you might also see a lot of this parallel play here, right? Where there's play near others, but the quality of the play itself is not really social or incorporating any back and forth. And then we might also see kids who interact, but they prefer interacting with much younger or older people, and they're just not as interested or capable in terms of their interactions with same age peers. So, for example, some kids on the spectrum might be really fascinated with babies and much younger children. They also might be kids who are preferring to talk to adults, like gravitating toward the teachers at recess and doing less interaction with same age peers. And then many kids on the spectrum may want to make friends their age, but they might not know exactly how to do this or have a complete or realistic idea of what that friendship entails. So they might struggle to tell you what they do with friends or just discuss what friendship means. They might kind of talk and think about friendship in more of a one-sided manner or based solely around their shared interests or special interests. And so I wanted to play this brief video of kids talking about friendships just to show that even young kids, are able to communicate in some way about these topics. So I'll go ahead and play this.
No. Oh. It's when somebody meets each other and they just start to really like them. Friendship is a thing that's between people that you really, really like. What do you do with your friends together? Share with them and play with them. Run around together and play tag together, play hide and seek together. Tag, hide and seek, freeze tag. Well, I don't play big kid games. I have a puzzle game, a socks game. And you can play games by yourself because it's not fun. How do you treat your friends? I treat them really nice. How do you feel? So glad.
That's just a cute example of, even though these are not the most sophisticated answers that, you would ever hear, they still show that even some very young kids have some insight and awareness around social relationships like friendship and kind of what's involved in those. I heard a lot of, them talking about, we do this together, or this is something between people, and kind of getting that social concept, even though they're talking in very developmentally appropriate ways too. Also, like the little guy that has some insight about what big kid games are and what his level is too, just kind of showing that dynamic as well. And then with older kids than this, of course, we would expect even more sophisticated answers, and then insight to be even sharper into differences between some other types of relationships. So for example, what's a friend versus what's just a peer? Some of those more subtle differences. With older autistic individuals, we might also see just limited flexibility in relationships. So we might see kind of insistence on playing by fixed rules, or having some difficulties with turn taking and sharing, or perspective taking with others. We also might just see difficulties adjusting behavior to suit different contexts and situations. So kind of understanding what's appropriate in this one situation versus another. Kind of understanding what different expectations or social norms are, and this concept of having a filter in some situations versus others. And then also just the understanding of social cues and how to adjust your behavior accordingly based on social cues from others. So for example, picking up on if someone's not really interested or comfortable with the situation at the time. And then, we're most likely to see these challenges happen in situations that are new for people, that are novel or unsupported or unstructured. And even autistic individuals who have really nice communication skills might struggle socially due to the effort and anxiety of consciously having to calculate what comes really intuitively for other people. So as you see here in this diagram, they might think through every step and detail for what we think is really a straightforward interaction. I think this can happen a lot for young people who are really bright and socially interested, but who might just not naturally pick up on social norms and skills that come kind of second nature for other people their age. And this, of course, is not to say that we want or expect all young people just to conform to all norms, especially because sometimes I think our social norms and expectations can be really arbitrary things or just really complicated things. But this is just to note that some individuals on the spectrum experience a lot of internal stress around situations that come very automatically to their peers. So we also just wanted to see, with this social piece, I think this is one area that can look such a variety of ways, going from, complete limited interest and interaction to these nuances that we're talking about here too. So would love to hear just a few examples that folks have come across in their own work and that have made them kind of question whether autism is a possibility.
All right, we are switching gears finally to restricted and repetitive interests and behaviors. So as Tori mentioned earlier, there are two main categories of autism, and this is the second main category. And for a diagnosis of autism, when we think about the DSM-5, we're really looking at individuals having 2 out of the 4 kind of categories in the RIBs. And again, this is going to look very different, right? It's going to look very different no matter what individual you're working with. So when we think about restricted and repetitive patterns of behavior, you may think about kind of repetitive physical movements or mannerisms that a person may demonstrate, things like spinning, maybe hand flapping, tensing body, or posturing fingers. And some of these are often kind of what we think of when we think about autism, but these mannerisms can look very different depending on the individual. With these sorts of body mannerisms like spinning or tensing or finger posturing, hand flapping, we often will tend to see these when children get really excited or when they get really upset. So these are often ways of coping. We work with a lot of autistic adults, and they are able to kind of speak to their experience of demonstrating these repetitive movements as a way to kind of them expressing their emotional situations in different ways. We will also potentially see repetitive or particular ways of playing. So with young kids, this can look like arranging things, repeating the same actions over and over. It could be spinning or dropping objects, banging things to activate them repeatedly. I worked with a very young child and their family who would run up to the top of the balcony in their house and just drop objects down and kind of go back down, pick it up, and then repeatedly kind of do that. Again, just different ways that we may see this present. We may also see differences in vocalizations. This can look like undirected speech. So kids who are maybe jargoning or using unexpected sounds. For older individuals, it may be kind of their tones of voice. Maybe just unusual or repetitive, potentially in kind of the tone of voice that they're using. They could also echo language, and this could be from people, maybe from their family members or parents. It could also be from elsewhere. Things like videos, could be YouTube, could be their favorite show that they're kind of scripting. And then same with kind of repeat catchphrases, right? Things that we often will sometimes hear in evaluations, different language that is coming from somewhere else, but the individual is using it and kind of scripting it in a catchphrase way during their conversation or during interaction. We may also see frequently individuals repeating certain sounds or words. Again, we may also see language that might seem kind of stilted or unnatural for a child's or developmental, for their age or developmental level. And so I worked with an individual who sounded, this was a younger child who sounded like a little professor, and that's kind of how his parents described him, right? Using a lot of kind of precocious language that was really unusual for his age. Many kids with autism will also show some preference for sameness. And I think some of you will even mention this in the Padlet, right? But this could include particular preferences, such as food being prepared or presented in a certain way. I worked with a child whose parents said they had to, present their food in a certain order and had very specific, almost like the picture, right? A very specific way of their food needing to be presented every day. And then you can also see individuals who may have that resistance to change. And this could be including things that we may think of really small changes. Two examples I can think of. One is a student I worked with. This was an older individual whose parents said they bought a new couch for their house, and it really threw their child into a state of distress at this new couch. And they didn't think there was the child had any specific attachment to the couch, but it really caused some level of distress for their child. And so we may see that. Another, again, older individual I worked with who really became quite distressed and had difficulty when mom had to take a different route home from school, right? They had, every day she had to take the same route to and from school. And then one day there was some road construction and that had to be switched, and that caused a lot of distress. So again, difficulties with transitions, we may see that throughout the day. And then we may also see inflexible or black and white thinking. So really kind of thinking about things in very rigid ways. And then rituals and routines that are very individualized and specific. These might be things like verbal routines where others have to respond in a certain way, like maybe the child mom or dad has to say a certain thing or respond in a certain way. Or maybe it's a habit that the child has created and needs to carry out consistently. So we see that quite often. And I know Tori had mentioned this as well, but kids with autism may also show interests that are restricted in range or repetitive in focus. And so here's a really great example of an individual who has a particular passion for vacuum cleaners. And, you know, it could again, could include interests that might seem surprising or maybe unusual for their age, but they can also be fairly typical interests that are just ramped up in terms of the unusual intensity of them. So for example, it might be a child who is really interested, kind of like Tori's example of Sonic, right? The child who had a passion and really strong interest in Sonic the Hedgehog. You know, it could be a show that they want to watch over and over again. It could also be a topic where they have a lot of detailed interest and detailed knowledge about, for example, dinosaurs. Or I worked with a couple of students who had a very strong interest in war and kind of just history, right? And so World War II, they knew everything you could know about World War II and the Vietnam War as well. So I learned a lot in working with them. And then some kids are also attached to kind of certain things or play in repetitive or particular ways with particular items, as we've talked about. And so sometimes we'll see kind of repetitive or particular ways of playing, especially as we're seeing here in these two pictures. So these are looking at kind of sensory differences. And so this is really important to recognize, because some of these ways in which sensory differences, especially in young kids, may play out may not be what we would typically think about when we think about autism. So it might be either sensory sensitivities, or individuals may have strong sensory interests. So these can look like things like smelling or mouthing things or items, feeling things really closely, so having like a strong interest in tactile features. And then also, as these pictures are showing, kind of showing a strong interest in inspecting or watching things very deliberately. And again, these are things that we often will see in young children, but they're not often the kind of sensory differences that you would think that typically come to mind when we think about autism. Some kids on the spectrum also react to things like pain, touch, or temperature more or less than you would expect. Or they might seek out rough physical play or kind of good physical kind of stimulation. So just some things to think about, because as Tori mentioned earlier, every individual with autism is their own individual, right? They demonstrate the characteristics in different ways. So in terms of thinking about the restricted interest and repetitive behaviors, what are some examples that come up with your own work with clients? So what are some things that you have been able to see in clients that you've worked with? Let me see the chat here.
Heather had a great example she put in here before.
Perfect. Oh, wonderful. Yep. So my husband has a car dealer. Yep. He has a customer who has 2 sons with autism. She purchases a new Mercedes SUV every 2 years, and all the features have to be exactly like the previous car, or the boys get very upset. Absolutely. That's such a great example. And wow, a costly example for that family. Goodness. But definitely you can kind of see that, and she's right, that mom's accommodating her two sons. That's got to be really challenging. Yeah. What are some other things that you all have noticed? Hyperfixation on certain toys. Absolutely. Yep. So we can see that could be on certain toys. It can be certain aspects of toys, right? Certain features on toys that children might get really fixated on or interested by. Where do you draw the line? You've got these are great, great comments. So where do you draw the line between a strong interest and autism? That's such a great question. And I work actually with a lot of adult autistic self-advocates. And we talk a lot about the social model of disability here, where a strong interest is something that a lot of people have, right? And so we really, when we think about, and we're going to talk in a few minutes about kind of thinking about the diagnostic criteria, and we really want to, it's not just, right? A diagnosis of autism is not just a strong interest. And when we see that for autism, when we see that strong interest potentially kind of getting in the way of other things, and I think that's where the functionality becomes can become challenging for folks. At the same time, we know that strong interests that autistic individuals have can really be seen as passions and can be leveraged and used to help increase motivation, especially when we think about older individuals, school age, once kids age up into school, where the social and learning environment can be really challenging for them, that utilizing those interests in a way to increase motivation can be really powerful. So that's a great kind of segue into when we think about prevalence. So really quickly, we know that about 1 in 44 children are diagnosed with autism. Although we know that it occurs across sexes and racial, ethnic, and socioeconomic groups, it's still much more or less likely to be identified in girls, some racial and ethnic minority groups, and then communities that experience systemic barriers to care. So given this, we're still learning a lot about how autism can vary, but we do know that there are some specific sex differences that we wanted to speak to. So we know that girls show fewer repetitive behaviors and restricted interests in general. And their interests also tend to be more socially acceptable and kind of expected. So when we think about that, we're thinking oftentimes girls will have interest in animals or dolls or music, or maybe TV shows or YouTube, that sort of thing, which is often kind of either socially accepted or also more developmentally appropriate. Girls often also show better developed language and communication skills, and then their sharing interests and that imaginative play is often stronger in girls than it is in boys. So then girls may also be better at adjusting their behavior to different situations. And we see this a lot in a lot of the self-advocacy work that's come out recently around camouflaging or masking, and how girls are much more, I guess, much better at camouflaging or masking their symptoms by mimicking others in order to fit in. However, this does often lead to more mental health concerns. And so thinking about that kind of in general, girls' symptoms tend to be more subtle, and we often see a greater discrepancy between what they report and what others observe. So because of the differences, girls with autism may not show as many of the challenges in early childhood, but may run into more difficulties once they age up into school or early adolescence especially. And so when we go back to that picture with the thought bubbles that Tori showed right before the restricted interest section, many of those individuals may have to put forth a lot of effort, especially when we think about girls and masking, around social situations that are just naturally more natural and comfortable for others. So we want to be really mindful of that. So just to summarize, all the core characteristics that we've talked about, we can really whittle it down to the presence of restricted and atypical behaviors and the absence of or limitations related to developmentally appropriate social communication behaviors. And we want to remember that, especially with social communication, it's not black and white, right? It's not a yes or no or all or nothing, but it's really more about the consistency, quality, context, and fluency of those behaviors that we want to be really mindful of. All right, so individuals with autism are also more likely to have additional medical and behavioral challenges beyond the core symptoms of autism, which often are things that are going to come up when you're working with them, right? These are things that are going to kind of spur on a referral or for evaluation. But these aren't specific features of autism, right? These are not things that are included in the diagnostic criteria, but are often those primary concerns. So what we wanted to do was provide you with some information to help in being able to make appropriate referrals, right? And making sure that you are catching those individuals that need to be referred for further evaluation. So I'm not going to go into these in great detail because I know we're running short on time, but we are providing these in handouts for all of you. So just really quickly, as you consider the clients that you serve, this information is really thinking about some of the challenges that come up when it comes to referrals. So when we think about, especially in very young children, the first two, so autism and language delay, and then autism, the next one is autism and global developmental delay. These are often things that are hard to tease apart. And so what we've done here is just really compiled some information to help you think through what you may be seeing and what may be, could it be autism? Could it be something else? But really throughout, when we think about looking at challenges in referral for autism, we want to really be making sure we're keeping our eyes and ears tuned to those core characteristics of autism, right? If we really focus on and see what are we seeing related to social communication challenges, and are we seeing a presence of restricted and repetitive interests and behaviors, then that's the information you need to know to say, yep, we need to make a referral for an autism evaluation. So, so this really goes through autism and language delay and kind of helps to really think through what are some of the differences that you may see in individuals who have autism versus individuals who are just presenting with a language delay. Here we have information related to autism versus global developmental delay, right? And we know that intellectual disability or global developmental delay is not part of the diagnostic criteria for autism. We also know that there's a lot of overlap. And so again, this information kind of helps you tease apart what is solely autism and what is solely global developmental delay, especially in those younger individuals. And when could it potentially be both? When you think it could potentially be both, you want to refer for an evaluation, of course, for autism to help tease that out even more. And then here we have, as mentioned earlier, individuals with autism can often have behavioral challenges that go beyond the core features of autism. And often those behavioral features can overshadow or make it difficult to tease apart autism characteristics from these behaviors. We want to recognize, and you all know this, that autism can absolutely co-occur with mental health concerns. There's a high percentage of individuals on the spectrum who also demonstrate anxiety, clinical levels of anxiety, depression, and who also have experienced trauma. We know that the level of trauma in autistic individuals is higher than the just typical population. And so we want to be really mindful of that. Here are just, again, some information that you can reference that will help kind of think about some of those considerations as you are referring for evaluation to help see, could there be other things going on? Could this just be autism, or could this be autism plus some other behavioral concerns? We definitely wanted to give you some materials that would be practical to use in your current roles. So the first document is a one-page checklist that's detailing all the examples we've just discussed that you can reference when making referrals for autism evaluation. We've also included a sheet about autism assessment, just really broadly, which includes some ideas for different tasks or activities that you can do informally to kind of note any autism characteristics prior to making a referral. That can be helpful when you're making a referral to kind of note some of the behavioral qualities and characteristics that you're noticing in your sessions with your clients. And then we've also included those considerations documents related to challenges in referring for autism evaluation that we went over. So those are all going to be handouts that you'll have access to, and we want to make sure that those are, in your hands. So we also know that it can take a while for an evaluation to happen once a referral has been placed. And so we wanted to share some things with you to help families access some resources while they wait for an evaluation. So early intervention is something that addresses present concerns. These are things that a child would receive through Tennessee Early Intervention Services, such as speech, occupational therapy, and ABA and developmental therapy as well. For school-age individuals, you would also want to have the family refer to the school for evaluation. And the school will do their own evaluation, and you could connect the family with the school principal, the school psychologist, or a special ed coordinator within their home school or district as well. And here we just have some additional resources for providers. So these are things that you might find helpful, resources throughout our state, but especially some resources within that are all online and also local to East Tennessee. All right. I think that's all we have for today. I think on my watch, we are actually at noon, so or noon our time, 1 o'clock your time. But we just wanted to thank you so much for your amazing engagement and your attention. And I think you're welcome to reach out. I know, Caleb, you have our contact information. So if there are follow-up questions, anyone is welcome to reach out to us. Thank you so much.
I really appreciate all your time. This is great information. I think especially, highlighting those resources, like, I think all those are critical, like what to do and all that. And it's super helpful. Thank you all so much. And I'll definitely, and anybody who sends a question in, I will definitely forward it on so that they can get back to you. I want to remind everybody as well, just to make sure Karen has put the link to the survey in the chat. So please take time to fill out that survey and give us feedback on, how it went today, and also like any suggestions for the future. I think you all had this suggestion, so we were able to reach out, and Dr. Rodrigues and Dr. Foster were kind enough to give this presentation that people have been asking for. And again, I'm so thankful for that, because this is much needed. We have so many kids and we're getting this question so often. So again, thanks for that, but make sure to fill out the survey and give us other ideas for things you want, which will help us guide us into the direction of who to ask and who to reach out to for future trainings. I want to remind everybody as well that our next Learning Cafe is in December. We'll skip December, as the third week in December is pretty close to the holidays for everyone. We'll start back again though in January, on January 20th, when Dr. Christine will be talking to us about problematic sexual behavior in children. So we'll have that presentation to look forward to. And also a reminder, if you have colleagues who weren't able to log in today, weren't able to join, that we'll post a recording of this online, and we'll send that out with our next email, but you can access it via YouTube as well. Thanks again to everyone. Thank you all so much. Hope you have a great weekend.